And in about 2016, we were starting to see an increasing number of patients that were admitted to the hospital with severe immunotherapy complications. So immune-related adverse events related to immune checkpoint inhibitor activation. And then I had that patient, that Andrea came to me. And his name was David, and he actually asked that I share his story widely. So I have tried to do so both in writing and talking about him. But the reason why it's so important to me is because he truly outlined the gap or the lack of information that we have in medicine in a specific arena. And with seeing his case and how we all came together, we had so many questions come out of that. And so he was a CEO himself, actually. He was a 64-year-old CEO of a productive tech company, and he really had it all till he was diagnosed with metastatic melanoma. Unfortunately, the melanoma was widespread, so it was lung, brain, and he had to go on therapy. And he was started on 2 immune checkpoint inhibitors to get the best response. And so he did great with cycle 1, but just a few days after cycle 2, he presented to the Massachusetts General Hospital to the emergency room. That's where I met him. And unfortunately, he was extremely short of breath. It turns out that he had so much inflammation in the lungs related to immune activation. So he had pneumonitis related to the immune checkpoint inhibitors. He almost needed life support, but we were able to turn him around, get the immune activation under control, and he was able to leave the hospital just 6 days later. Unfortunately, though, a month later, he represented to us to the hospital, and this time the immune activation, despite the fact we were trying to suppress his immune system, but it started to attack his colon, so he had colitis, and his nervous system, but in a very strange way, because he was having weakness of multiple parts of his body as well as sensory issues. And we tried everything, Bill. We tried second-line immunosuppression, we tried a third agent, and unfortunately, he succumbed to his toxicities and he passed away in the hospital, so he never made it out that second time. But it catalyzed us to really try to reframe the way we care for these patients. And so at our home institution, we kind of pulled 50 people from across 19 departments together to start to tackle the clinical care for patients with immune-related adverse events and the clinical and translational research efforts. And interestingly, right along with us, which is why I know it's making a difference in patients' lives, is we have had patients and patient advocates. One of them is actually David's wife, and she goes to me a couple of months ago and she said, Kerry, I just keep thinking there was not one single melanoma cell at the time of autopsy. And she said, I ask him over and over again, would you do it again? And she said, every time in my, reflections, he says, you bet. And she can tell the smirk on his face. And so just like Andrea said, patients will go to so many lengths. And it's just our job as we think about how to make these drugs even safer. And with this alliance and with this partnership, because we can't scale to all of the stakeholders that we need. So Project DataSphere got to have been so instrumental for us in bringing together the individuals. And we had that first symposium. So one of the 10 was on immune-related adverse events. And out of that really came a call to action that has been published, but it's also defined the real gaps that exist in this field. And one of them, just like I said, David's case was so challenging with his nervous system, and it affected multiple different parts. So these are atypical conditions. And so together, there was funding to really pull together 27 faculty members from across 15 different hospitals, academic centers, as well as we had FDA review and a pharma review as well to think about just taking the neurological immune-related adverse events, defining them so that those consensus definitions can form the registry basis and the big data work. And so that has been done. That is just the beginning.